Today we're going to be learning about canine large cell lymphoma. If you're a pet parent and you're here because your dog has been given this diagnosis, I'm very sorry. But knowledge is power, and Hope Veterinary Oncology Services is here to provide you with the information that you need to help you make the best decision for your family member. Hi, I'm Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home. So before we dive into lymphoma, let's just take a minute to talk about what a veterinary medical oncologist is. Then we'll talk about what cancer is, and then we'll talk about lymphoma. So a veterinary medical oncologist is a veterinarian who did about 4 years of extra training to become an expert in a particular field. So for me, obviously that was medical oncology, but there are specialties like surgery and internal medicine, neurology, ophthalmology, and so on. And all of us pretty much follow the same path. We do 4 years of veterinary school. I did mine at Western University of Health Sciences in Pomona, California. And then we go on to do a 1-year rotating internship where we rotate through different specialties: surgery, internal medicine, neurology, dermatology, and a lot of emergency medicine. I did my rotating internship at Garden State Veterinary Specialist in Tinton Falls, New Jersey. And then we go on to do a 3-year residency in our field of choice. So I did my residency in medical oncology at Cornell University in Ithaca, New York. During a residency, we practice only medical oncology under the guidance of experienced and board-certified mentors. We teach students. We do research. We have to publish at least one research project during our residency or before we're boarded. And we have to pass multiple rigorous exams. I've now been practicing medical oncology in the state of Washington for about 14 years. I've learned a lot during that time, and I want to share that information with anyone out there who needs it. All right, before we dive into lymphoma, let's get a little background. Your blood is made up of red blood cells and white blood cells. And there are different types of white blood cells that make up the immune system. There are eosinophils, basophils, mast cells, neutrophils, and lymphocytes. There are different types of lymphocytes, but we're primarily concerned with B cells and T cells. Cancer is really a complicated group of diseases, but put simply, it is one cell that's gone haywire and then divides and divides and divides until you have this overgrowth of cells. A lot of times that overgrowth of cells forms a tumor, sometimes multiple tumors throughout the body, and sometimes you have an overgrowth of cells in the blood system itself, so circulating through the vascular system. So in our case, we're talking about an overgrowth of lymphocytes. Now in people, there are many types of lymphoma, but in dogs, we're primarily dealing with 3. Large cell lymphoma, which can be broken down into B or T, small cell lymphoma, which can also be broken down into B or T, and T-zone lymphoma. Now in this talk, we're going to focus on large cell lymphoma. Now, like I said, lymphoma is a cancer of a white blood cell, the lymphocyte. Your white blood cells and your dog's white blood cells are not just circulating in the vascular system. They're found in every nook and cranny of your body. So we can find this cancer anywhere. We can find it in the skin, in the eye, in the liver, and the lymph nodes. Now, the most common form of lymphoma is found in the lymph nodes. And the most common way that a dog will be presented to a veterinarian is with enlarged lymph nodes. Sometimes they're not even sick. A family member or the groomer just feels these big lymph nodes either under the jaw, in front of the shoulders, or behind the knee. Some dogs feel sick from their lymphoma. They may have a decrease in energy, a decrease in appetite, vomiting or diarrhea. Sometimes they're having trouble breathing or trouble swallowing with these big lymph nodes in their neck. Unfortunately, lymphoma is a very quickly progressive disease. So even if patients aren't sick yet, they probably will be in the next few weeks without any treatment. Now, treatment typically involves chemotherapy. Now, hold on, wait a minute, don't go anywhere. I know I just said the word chemotherapy and people have a lot of opinions about that, a lot of worries about that, and I get it. But chemotherapy is different in veterinary patients than it is in humans. We really are trying to maintain an excellent quality of life while a patient is going through treatment. So we use lower doses and different intensities of schedules than they do in people so that we can achieve this. Roughly 75% of patients do not have negative side effects from chemotherapy. Now, if one of my patients is in the 20 to 25% of dogs that has negative side effects, like decrease in energy, not wanting to eat, vomiting or diarrhea, especially for multiple days, I'm going to change the plan. We can lower the dose of the drug that made them sick. We can switch out one drug for another. We can extend the interval of that drug. We can be aggressive with supportive care, or we can just omit that drug from the protocol. My point is there are a lot of ways to change the plan. Now, typically a dog is treated weekly for the first 8 weeks, and then every other week for another 4 months. And when we do this, we typically see an average survival time of about a year. Some patients live much longer than that, and some patients have really resistant lymphomas and they don't respond to that protocol, and they may not live as long. Now, what if you live in Yakutat, Alaska, or Jackson, Mississippi, or you're one of the millions of Americans who do not have access to a veterinary oncologist? Or maybe you do live near a veterinary oncologist, but that protocol just doesn't make sense for your family, for your work schedule. Maybe your dog hates being in the car, and so going to the veterinarian every week and even every other week is just too stressful on him or her. Or they love being in the car, but once you get to the veterinarian, they're freaking out. So is there anything available for patients like that who either don't have access to veterinary oncology or who just cannot be brought to the clinic that often? Now, I do believe if a family can't proceed with weekly IV chemotherapy, that doesn't necessarily mean we shouldn't do anything. There are a lot of oral medications that we can use and combinations of oral medications that we can use to help achieve remission and try to keep a patient in remission for as long as possible. There are drugs like lomustine, chlorambucil, cyclophosphamide, procarbazine, temozolomide, a newer drug called Laverdia, and good old prednisone. So there are a lot of options there and a lot of ways to combine those medications safely to maximize survival time. Now, when we treat with oral medications, especially if we're just treating with one oral medication, we may not see as long a survival time. We're able to achieve remission, but maybe not for as long. If we treat with multiple oral medications, we may be able to see a longer survival time. Now, even though you can administer those medications at home, you still need the help of a veterinarian. So when I'm treating a patient with oral medications, sometimes I'm seeing them once every 3 to 4 weeks. So I know I just mentioned some side effects that you can see at home, but there are side effects that only a veterinarian can see on their end of things. Things like a low red blood cell count, a low white blood cell count, low platelet count, elevated liver values. These are things that we can test for in the clinic and then tell you if the next dose of chemotherapy is safe to give. We can also tell you if that chemotherapy is even effective and worth giving another dose of. So again, what if you don't live near a veterinary oncologist? Will your general practitioner help you with this? Maybe. I've been helping general practitioners from Alaska to Georgia help treat their patients with cancer. I do this by first chatting with the family, talking to them about what the general practitioner has already done. I can't make a diagnosis or prescribe any medications for a patient that I haven't seen in person, but I can talk to the family about what's been done and what the diagnosis is and what that generally means for most patients and what the general treatments are for most patients. Then, if the family wants to move forward with treatment, I can provide the general practitioner with written, detailed, comprehensive guidelines on how to proceed with treatment for lymphoma. And if the family tells me or the veterinarian tells me that oral medications are the only option, then I will make a protocol with only oral medications specifically for that pet. Again, if you came here because your dog has been given this diagnosis, I am very sorry. It is okay to be sad. It is okay to be angry. It is okay to be frustrated. It is okay to be confused. If you do live near a veterinary oncologist, I encourage you to make an appointment for a consultation. Knowledge is power. That veterinary oncologist will be able to give you all the information you need to help you make a decision on how to move forward. Having that consultation does not commit you to proceeding with IV chemotherapy or any treatment at all. But that information will be very valuable to you. If you don't live near a veterinary oncologist, I encourage you to ask your general practitioner if it's okay to reach out to me or another virtual oncologist out there. Again, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home.